Why your Social Security retirement deposit may actually decrease in 2025. Hello, I am Kevin Knaus, an independent health insurance agent, and I work with people to enroll them into Medicare Advantage and the Part D prescription drug plans. And the Part D prescription drug plans in particular are changing for 2025, and the monthly premiums are going up. I've had several of my clients contact me and say, geez, look at this increase. And I've noticed it while looking at the plans as well. Some of these premiums are going up double, triple, quintuple in 2025 from what they were in 2024. And many people who are taking Social Security retirement benefits have their Medicare Advantage or the Part D prescription drug plan premiums deducted from their Social Security retirement check that's deposited right into their checking account. And if those premiums drastically go up, it may swamp the increase of the Social Security retirement that people should be receiving in 2025. So what's going on with the Part D drug plans? Well, in 2024, the maximum out of pocket that someone had to pay for prescription drugs was $8,000. In 2025, it goes down to $2,000. And there were some other changes to the Part D drug plans. All of the insurance companies took note of this, and many of them, their premiums went whoop, they went up. And it has been notified, they have notified the Medicare beneficiaries through the annual notice of change, but not everyone reads all those documents. So those premiums are going up, and it may be a shock for some people where they thought they were getting a little bit of a bump in their Social Security to actually see that they will be receiving less in 2025. Because Social Security says that the annual benefit will go up 2.5%. So what does that look like for someone? So let's say someone has a benefit of $2,000 per month Social Security and it's being deposited. It will increase by 2.5%. So the deposit should be $2,050. Now, of course, there are the deductions for the Part D and the Medicare or the Medicare Advantage plan. But let's say that someone had a Part D prescription drug plan in 2024 at $30 per month. And then it goes up to $85 per month. So that's a $55 increase when the individual only received a $50 increase on their $2,000 2024 benefit. That means that if it was just straight across the board, that $2,050 would be reduced to $1,995 because of that dramatic increase in the Part D drug plan. Now, it still may be worth it to the individual to pay that extra premium because the drug plan may be better. But people really need to see, will the drug plan be better for them, especially if they're not taking any prescription medications. They just have it in place so they don't get hit with the late enrollment penalty for not having a Part D prescription drug plan. So you really need to look at how your plan is changing. Some of the premiums, most of them will be going up. Some drugs have been dropped. Some drugs have been put onto higher tiers, and people need to make sure that the pharmacy that they're using is still in network and a preferred pharmacy, because some pharmacies have been dropped or they've moved from preferred to standard, which means the costs are going to be higher for the drug plan. So the Social Security retirement benefit deposit may actually drop because the Part D premiums are higher, but the overall savings on the drugs, it may be worth it unless you're taking no drugs at all or you just have generics. Then a big increase in the premium is just money out the door, money wasted. So we have until December 7th to change any prescription drug plan enrollment December 7th is the end of the annual enrollment period. And then if you just have original Medicare with a Part D drug plan, you are locked into that Part D drug plan for the rest of the year unless you move to another state. So if you know that your drug plan is going up exponentially in the premiums, you need to review your prescription drug plan, or if you're helping a family member or a friend, review that for them to see if it makes sense to change to another plan that has a lower premium or will cover their drugs, or maybe they do have the best plan for them, even if the premium is much higher. Well, if you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for insuremekevin.com, I'm Kevin Knaus.